Before I get into the body of my talk, I too would like to recognise the traditional owners of the land on which we meet, the Gadigal people of the Eora Nation. In paying my respects to the elders past and present, I always want to pause about paying my respects because it is increasingly becoming a tip of the hat. And for me, growing up in the Blue Mountains, I was taught that the Blue Mountains were overcome by three great white men, Blaxland, Wentworth and Lawson. I wasn't taught about the trade routes that they followed, the trade routes that had been in place for thousands of years, and I wasn't taught about the fact that there were massacres and wars fought along the Hawkesbury River and out along the Liverpool Plains. And we know about this today, and I know about this today because people kept telling their stories. And for me, stories are very important, and stories will form the basis of my talk to you tonight. I wonder if you've seen this image on your TV screens over the last few weeks. I certainly hope that you have. It's an image that my union's been using to talk about the implications of healthcare in the upcoming federal election Saturday. The premise of our message is that if the public doesn't care about what's happening to healthcare, then the nurses can't care. Their hands are literally tied behind their back. Make no mistake, the healthcare system in Australia and here in New South Wales is under sustained and consistent attack. And it seems from the outside that those attacks are coming from varying angles and varying causes, but at the basis, all of them, as I'm sure this room would appreciate, is neoliberalism. I'm starting with this image for two reasons. One, because the healthcare system is under attack and the population needs to know that and the population needs to do something about that. But also because tonight's talk was it posed a question: can the TPP be blocked in Australia? I believe the answer is yes, but not with our current trajectory. Not with our current trajectory. And I give that answer in part because of the story that lies behind the image that I just held up. The person in that image is a real-life nurse and a proud member of the New South Wales Nurses and Midwives Association. I'm going to call her Jay to provide some anonymity. So this is Jay's story, at least the part that involves trade. Jay rang up the association sometime late last year, concerned about the potential impact of the China Free Trade Agreement on nursing. So Jay's a community nurse, and we got talking and I started to talk about the TPP. And Jay got really involved in trade from that point on, concerned about the China Free Trade Agreement and outraged about the TPP. Understanding why Jay became outraged about the TPP and understanding why a bunch of our members have become angry and active around the TPP helps us understand how we mobilise those people that Pat was talking about that are needed in order to stop this evil trade agreement. So, as I said, Jay's a community health nurse, and community health care is being increasingly privatised and the workforce de-skilled. In New South Wales, the government here has a very clear policy of privatising healthcare. You can go to our website and you can have a look at our privatisation map, and you will see that the spots are appearing more quickly than they would measles on a young child. The rate of privatisation is really quite scary. So, the acute hospital system is increasingly putting pressure on the community healthcare system. The churn, the number of patients coming in and how quickly you are discharged from an acute hospital is increasing. And the acute hospitals are depending on the community health sector to pick up the slack. But the community health sector is facing funding cuts, staffing cuts, and are struggling to provide services. In fact, a lot of our members talk about the level of documentation that is required now exceeds the amount of care that they provide. So the hours they spend documenting the care they provide is bigger than the hours of the care they provide. So when we needed a face for our federal campaign, Jay was an obvious contender to be the person on our ads, to be the person on our posters. And as I said, for me, Jay's story of engagement on the issue of trade, in her story lies the answer as to whether or not we can block the TPP here in Australia. to be blunt, we can if we care enough. So why do nurses like Jay and our members, our 62,000 members, care about free trade agreements? Most nurses and midwives I talk to got into the profession because they care about people. They feel that they make a positive contribution to the lives of people every day. And they see themselves as making a contribution to the communities in which they live. It means nurses and midwives are typically strong supporters of universal healthcare. Universal healthcare being defined as equity in access to quality healthcare without being financially disadvantaged. Universal healthcare speaks to the values we as nurses and midwives hold dear to our hearts, and values that we as trade unionists hold dear to our hearts. Values of fairness and equity. Nurses and midwives want a healthcare system where people are treated on the basis of their need, not their worth, and where healthcare resources are allocated based on need, not based on budgetary decisions that have their genesis in some failed trickle-down theory that we're currently under. So these are values of transparency and accountability. So this is why members of my union care, and why we're angry about what's going on in healthcare under the current political and economic leadership of this country, and in fact, unfortunately, across most of the globe. We care because our values are being challenged. So some examples and some more stories. One of the biggest killers in this country, in fact one of the biggest killers across the globe, despite what you might hear, is not a particular virus or a particular politician, it's non-communicable diseases. Diseases like cardiovascular, cerebrovascular, diabetes, obesity. And this is not a first world problem. In fact, the highest incidence of non-communicable diseases, NCDs, is Tonga. Tonga has the highest rate of NCDs in the world. So the treatment and prevention of NCDs is well known and holistic in nature. There's a mixture of education, lifestyle adaptation, medicine, and maybe surgery if needed. And treatment and prevention of NCDs is improving all of the time. So from this you can understand that nurses and midwives, we really like food labelling. We really like the requirements that clearly expose the true nutritional value of that snack bar that's heavily laden in sugar and salt but is sold as a healthcare bar to parents and their kids. We like the labels that point that out. We like labels that require companies to put on their products that use smoke warnings that that product will kill you. Not might, but will kill you. Labelling allows consumers to make informed decisions. They're a public good. But the TPP and other free trade agreements seek to limit labelling requirements on foods, making it harder, and drinks and alcohol and cigarettes and everything else, making it harder to enforce the provision of information to consumers. How can we reduce the incidence of NCDs if we are unable to allow the public to educate themselves as to what they're eating and what they're consuming? The TPP challenges our values of transparency and challenges the knowledge that prevention is cheaper than the cure. How many of you in the room tonight have seen a GP in the last 12 months? And how many of you got a script for some medication for the GP in the last 12 months? And you took that script down to see the chemist, and the chemist said to you, would you like the name brand or do you want generic? And you said, generic, because you know that the generic medicine is at least as effective and is cheaper. Generic medicines are available because the patent period is expired. It allows other manufacturers to produce the same or similar medications, bringing down the costs. So that's really important to third world and developing countries, but as you can see from the hands raised here tonight, it's important for all of us. In Australia, these drugs are safe and affordable because we have a robust regulatory system. We have the Pharmaceutical Advisory Board and the Pharmaceutical Benefits Scheme. And in Australia, healthcare professionals are regulated. These regulatory institutions act to ensure that the treatment and medicines we rely on are safe, effective and affordable. But the TPP will give pharmaceutical companies longer patents on their medicines and on new and existing medicines. So this is going to delay or even prevent generic medicines from hitting the market. Andrew Robb, the then Trade Minister, assured, lied to, the Australian population that he defended our 5-year limit for patents on biologics. but he simultaneously told the American pharmaceutical companies that it was 8 years at a minimum. So he's lying to one of us. These are cancer treatment drugs that we're talking about here, and our elected officials have chosen profit over people. Now your shame comes in. The TPP also allows pharmaceutical companies timely opportunities to make comment during the decision-making processes linked to the PBS. So while this ability already exists, our concern is that with the inclusion of the ISDS provisions that Pat outlined, will allow pharmaceutical companies to sue the Australian PBS for not being able to make timely when they considered it to be timely. Because our healthcare system is predominantly public, for the time being anyway, it means we can hold politicians, institutions and ministry officials accountable for the services we receive. We can lobby, protest, make submissions and increasingly gain access to data linked to performance and outcomes. We have a healthcare system that, at least in small ways, but potentially in bigger ways if we choose to engage, has a level of transparency and accountability about it. But the TPP, through the inclusion of ISDS, will give multinational companies the right to sue our democratically elected government for making decisions that may affect their profits, even when those decisions are made in the interests of health or our environment or our community. Pat gave the example of Eli Lilly suing the Canadian government. One of the technicalities that the government was concerned about was the sample size that Eli Lilly was relying on to prove their case that their medicine was effective. It was a sample size of something like 36 people. The combination of these issues, ISDS, patents, the attack on the PBS and food labelling laws, means that there will be a space created in the Australian polity where decisions are increasingly made or not made on patent ownership and profit, not in the interests of the community. My union talks about the Americanisation of healthcare in this country. What do we mean by that? We mean a majority privatised system where the ability to pay determines the level of care you receive, where a healthcare issue can send you bankrupt and unemployed due to incapacity to pay. So I was fortunate enough to be in the US a couple of years ago, and it was at the Recall rally for Scott Walker in Wisconsin. And people were marching around the Capitol and people were marching all day. And on one of the laps around the Capitol building, I saw a guy sitting down taking a breather, and he had a sign up that said, "Save our social services." So I sat down and had a chat with him. This guy's retired, he's a diabetic. He has no major income. He relies on his insulin and a few other medications to keep him healthy. Scott Walker was planning on taking away Badger Care, their version of Medicare for that state. What this man was facing was a future where he had to make a decision. He could do 2 out of 3 things. He could pay his rent, he could buy his food, or he could buy his medication. He couldn't do all 3. This is the system that we're fighting to prevent coming in here in Australia. Trade agreements like the TPP and the others that I'm going to mention in a minute open the door to privatisation. They open the door to removing the regulatory processes that we hold so dear in our healthcare system. A personal story. My wife is a breast cancer survivor. She's now 7 years clear from breast cancer. We went through the local public hospital system and got excellent care straight away during the Christmas period, not a problem. We had to pay some gap payments for some of the medications that were required to keep Jenny alive. Friends we have in America faced exactly the same type of breast cancer, and it was only for the fact that they could take out a mortgage on their house that they were able to keep their family alive and running. It shouldn't come down to a decision of how much money you have. It should come down to access, universal healthcare. Martin Shkreli, the CEO of a US drug company, brought the rights to a HIV drug treatment, and he hiked the price from $13.50 a course to $750 a course. The TPP will leave us exposed to the actions of CEOs like this. Public backlash saw him reduce the cost down to $675. It was very big of him. And straight away, he bought the rights to a drug that targets parasitic infection that results in heart failure and is prevalent in South America, and he did exactly the same thing, jacked the prices up astronomically. There was outrage in the West when it was around HIV treatment. There was nothing said when it was around the parasitic infections that are rampant in South America. You see, although this is an extreme, although real example, it points out that in business, the first priority is profit. We give it a nice soft legal term in Australia. We call it fiduciary obligations. In other words, you service the interests of the shareholders or the owner. It's your legal requirement to do so, to put profit over people. Do we really want a healthcare system that is based on that principle? A report by a US-based organisation, the Commonwealth Fund, stated that 16% of Australians, so that's a US-based organisation, looked at healthcare affordability in Australia, and they found that 16% of Australians who skipped a dose of their medicine, didn't get a script filled, or chose not to see a doctor, did so because of cost. So on my calculations, there's roughly 40 people in the room tonight. Have a look around. 6 people in the room under this survey didn't get their script filled, didn't take their medication, or didn't go and see a doctor because they couldn't afford it. The TPP will push up the price of medicines. All of this means that people are presenting to our acute care services and placing further pressure on a system that is already under attack. And the only solution the current economic thinking can provide is to enforce more user pays and make decisions and make medicines more expensive. They sign trade deals that lock in the problem they say they are trying to solve. The TPP threatens the things that nurses and midwives care about. It threatens our core values of equity, fairness, transparency and accountability. Midwives care about trade agreements because we care about our healthcare system, and the current raft of free trade agreements threaten our healthcare system. It's not just the TPP. What capitalists miss out on in the TPP, they will achieve through the RCEP trade agreement. US trade reps have already made it clear that what they can't get through the TPP or the Atlantic cousin TTIP, they will achieve through the Trading Services Agreement. And for those of us that believe in social democracy, or at least public services, the Trading Services Agreement is a massive threat, as it seeks to privatise public services, and it seeks to make sure that you cannot return a previously privatised service to government hands. You'll remember Port Macquarie Hospital was a privatised public hospital which failed in the 90s. The waiting list blew through the roof. Under TISA, the government wouldn't have been able to bring that back into the public fold. A common thread in each of these trade and investment agreements is the lack of enforceability of workers' rights. As Pat said, the French multinational sued the Egyptian government allowing a rise in the minimum wage. Abuse of workers goes unchecked under these free trade agreements. And why free trade agreements discourage workers' rights is answered by the corresponding decline in middle income wages in the US and union membership decline since the 1960s. Bear with me. So that's the graph that shows that correlation. As union density falls, so too does the wages of middle income Americans. That graph could easily be represented here in Australia as well. It's clear why the corporations come after unions. So this is why, when answering the question, can we block the TPP in Australia, I said not on our current trajectory. On current trajectory, the LNP will win government, and that means more free trade agreements, less regulation and more privatisation. It will mean a continuation of the attacks on our healthcare system, which means the hands of our nurses and midwives will remain tied. But we can have a universal healthcare system, and we can block the TPP. We need the Senate to block the implementing legislation of the TPP, and if the ALP or Xenophon win, then we need them to keep their promises. And that's where you and I come in. I said earlier that our healthcare system has a potentially larger democratic process open to it if we choose to engage, and choose we must. We must choose to act on the things about which we care. We must choose to act on our shared values of fairness, equity, transparency and accountability. By meeting with newly elected senators and talking with newly elected MPs, we can influence their decisions. But by each of you taking friends to go and meet those same people, we can really start to have an impact. Despite what the politicians might say, we have a political class that is slave to the media. They are slave to the opinion polls, and more importantly, they're a slave to winning your vote. We beat them on Medicare co-pays, and we beat them on the privatisation of Medicare. We can beat them on trade. Tonight I told some stories about Jay, about my family, and stories about people I know in the US. Our personal stories remain very powerful. Academics and organisations such as the fantastic AFTERNet can give us the facts, but retelling those stories to others using those facts connects our values, and on those we can act. To be frank, not enough of us are telling our stories. Not enough of us are meeting with our senators and our MPs. Not enough of us are getting out on the streets in front of the Senate inquiries, and that's the challenge that lays ahead of us. I started this with the story of Jay. Jay needs you. If you don't care, we can't care. Thank you.